Welcome to the Black Women's Health Podcast. I'm Dr. Rahman. I remember it clearly. She was sitting across from me as I was asking questions about her medical history. Out of the blue, she said, "You're actually looking at me." She then proceeded to say that had not been her experience with other non-Black doctors, which is why she had gone out of her way to find my office and this practice. And just recently, another patient with another Black doctor wrote a review that said, quote, "The best doctor I have met to date. She and her team are lovely and so nice. My experience from the first contact to the post-op appointment has truly blown me away," end quote. She then goes on to say that she would recommend this Black doctor to all of her friends and family. And so the question today is, why do we love Black doctors? Is it because Black doctors demonstrate cultural competency with their patients? And what and how do we mean when we say cultural competency? For our consideration, let's just say for now that cultural competency in healthcare refers to the ability of the doctor or healthcare providers in general, healthcare organizations, to effectively deliver healthcare services that meet the social and cultural needs of their patients. It is not a one-size-fits-all approach to healthcare. It does not stereotype or make assumptions about patients based on their race, based on a provider's beliefs. They don't make assumptions about a patient's behaviors. Specifically for Black Americans, its cultural competency would acknowledge that there has been historic trauma and the impact of racism and discrimination, abuse of Black patients has been experienced time and time again, experienced not only by Black patients, but racism is inherent in the healthcare system and has impacted Black doctors. So acknowledgement of our history and the impact that it has had on present day is paramount. Likewise, recognizing that there are specific health risks that are prevalent within Black communities, knowing that the accountability and the solutions depend on an engagement with the community, healthcare providers, and healthcare leaders to find optimal solutions. Cultural competency is important, and Black doctors are often perceived to be more likely to understand the cultural, social, and economic factors that affect the health and the healthcare experience of Black patients. And as a result, Black patients tend to feel more comfortable and trustful with Black doctors, believing that they are less likely to face racial bias and discrimination. Black doctors, similar to Black patients, have experienced similar social stressors and challenges and know the impact of racism and its impact on mental and physical health. This shared experience between doctor and patient can foster a greater sense of empathy and understanding, which leads to patients being better able to communicate effectively their concerns and have their symptoms taken seriously. And we all recognize that representation matters. Seeing Black doctors in healthcare is empowering for Black patients. It counters all of the negative stereotypes and provides positive role models for patients and their children. And probably most importantly, there has been documentation that when Black patients are seen and cared for by Black doctors, there are better health outcomes. Now consider that the U.S. population for Black Americans is approximately 13%. And Blacks in the U.S. tend to have worse health outcomes, whether we're talking about high blood pressure, diabetes, renal disease, maternal mortality, whereas only 5% of the practicing physicians in the U.S. are African Americans or of African descent. So it's easy to imagine that current Black physicians can be easily overwhelmed by the number of Black patients who would like to be seen by them. So what can we do? One solution is to have more Black doctors. Not the only solution, but one solution would be to have more Black doctors. And this could be facilitated by reducing the financial burden that one has to acquire in order to attend medical school. It is estimated that the cost to attend medical school for 4 years ranges between $150,000 to $250,000. The cost is prohibitive, and most physicians, including Black physicians, are now employed by healthcare systems. And if these healthcare systems do not publicize that they have Black physicians on staff, how will we ever know? Unfortunately, most patients then resort to healthcare directories, and they are often out of date, And so we at Today's Woman will be releasing a local physician directory for the Philadelphia area in 2024. Stay tuned.